Hi everyone, welcome back. Have you enjoyed your sessions? Haven't they been amazing? I'll just go over here a bit more. They've been incredible sessions. I got to as many as I could, and it's just remarkable, the wonderful information. Look, at this conference, I'm thinking, why can't the general public join you? Because everything I hear, I think this is so important for just ordinary civilians to hear. All the information about your skills and what you can provide and the different models of care that are being discussed and every bit of information. I've just been taking multiple notes, especially as I've got older parents now. My mum's 93 and my dad's 91. He's her toy boy. And they're both still independent because together they make sort of one half. And so they're living independently. But when they get to that age, you know, just people in the family members really become their first port of call for health. And we need to know all this information, how to access health. And it's very hard to navigate the system. If you didn't have an advocate, if you didn't have a family member or something, I don't know how people with any sort of diminished capacity could possibly navigate the health system apart from ringing the GP and making an appointment. But everything else is very, very complex. But yet, the discussion seems to be making primary healthcare nurses more visible, right, and more utilised. And I hope you're tweeting that. Have you been tweeting something like that? Who's tweeting? Anyone tweeting? 1, 2. God, you're all so old-fashioned. Get with it. I used to have a Twitter account and then I got trolled. Probably I deserved it, but it was harrowing. And so my husband suspended my account because I was getting so nobody loves me. And so he suspended my account and then a Russian took it. A Russian took my tweet. So now there's @Kittson or whatever it is, #@Kittson is not my account. It's all in Russian. So I sent I communicated with Twitter people and said, oh, could I have my name back? And they said, no, there could easily be a Russian Kittson. I went, okay. And I translated I thought, what if they're, tweeting something really rude, but they were tweeting something like, the moon looks lovely on the lake tonight. So it must have been drug deals, I think, so. But there's a lot of the sessions are about, if you do tweet, it's really important to tweet because it just can reach so many people. And so if you tweet something like, we want more access to our brilliant primary healthcare nurses, something like that, and then retweet it, and then, it just creates this whole massive thing. That's a technical term, by the way. So, and if you tweet, you will win something. I don't know how that works, but look, if you've tweeted something, just go to the APNA stand, and they will give you this really cool T-shirt. Have you seen them? Yeah, they're cool, right? Yeah, you can wear them tonight to the cocktail party. Yeah, they're really cool, so you can get a T-shirt. I also want to say there's a nurse celebrating her 50th year in nursing today. Elizabeth Blucher, where are you? Where are you, Elizabeth? Where is she? There! Where are you from?
Well, originally from here, from Brisbane. Yeah. I trained at Princess Alexandra Hospital. There must be a few left. And it's 54 years since I actually started and 50 years since I graduated on the same day as a registered nurse, which was back in January. So.
Oh, Oh, fantastic.
I'm not giving up.
Don't. We need your experience, your expertise, your wisdom, everything that comes with 50 years of practicing. That's fun. And you love it?
Absolutely, yeah.
Are you going to learn to tweet?
No. That's one thing I don't have. I don't have a Facebook account.
Oh, you don't have Facebook?
No.
I have, but I've only got 11 friends, and I posted once 6 months ago or something. Yeah.
I don't think I'd have any, but anyway.
You don't have time. You're a primary healthcare nurse. Who has time to go on all these stuff?
Yes.
Well, congratulations. We're really proud of you and great achievement.
Yes, just stick in there, girl.
I think we need a hall of fame. I'll walk with you. These stairs are like lethal.
They are.
They're lethal. Oh, here's a gentleman. I didn't see you, Peter. That's a nice name. So I got these elderly parents, and some of the workshops have been about advanced care planning and the conversation about dying and that, and they're hard conversations to start. And my dad doesn't want to talk about dying at all, but my mum, I wanted to talk to them about dying, and it's a hard one. As I said, it's a hard one to start. You can't say, "Hi, Mum, how you feeling?" "Good, that's great." "Well, your time's nearly up, don't you?" In the near future, judging by those chest pains you're getting. So it's time to talk about dying, just in case it's slow or painful. I mean, we don't want to leave it to the last minute, do we? When you may be delirious or think I'm the postman. So anyway, my mum's absolutely happy to talk about dying. She's been talking about dying since she was 40. I now realise it was menopause. And she used to say to me she's 93, right? So for 53 years, she's been saying to me, Jean, just in case I don't die quickly, but I lie there like a vegetable, and I'm sure I will. Just turn off the machine. Promise me you'll turn off the machine. I don't even know which machine she has in mind. Probably the iron. So I said, of course, Mum. I don't know what my religious sister will think I'll have to tell her I'm sort of, God's outsourcing or something, I'm not sure. But my dad won't talk about it at all. But they're very happy to talk about funeral plans and things like that. My dad, who was excommunicated when he married my non-believing mother, he was excommunicated from the Catholic Church. When we had the conversation with him about funerals, he said, "I want a full Catholic mass. I want to be buried in consecrated grounds, and I don't want to be cremated." And I'm going, what? He hasn't been into a church since he married Mum, and before he married Mum. And I said, "Sure, Dad. Okay, Dad. Well, we'll see what we can do." And I said, "Sure," but now I found out that if you don't go to church, you can't get you can't get a full mass unless you know a bishop or something. So, but Mum, she just wants to be cremated, and she wants her ashes scattered at sea, accompanied by a lone piper, who presumably then has to swim back to shore. She's not even Scottish. I don't know. Lucky she hasn't got a thing for brass bands. We have another important session coming up for you now. A really great session, and it's about e-health. And I've just got to read this out. The session is on e-health. I've put my glasses on. Here we go. So. I'd like to introduce your next session speaker, and that is Peter Delfante. Peter is a general practitioner in private practice in Adelaide, as well as a public health physician. He is also a senior clinical reference lead with the Australian Digital Health Agency. His previous roles include clinical lead for the McKinsey National Diabetes Care Coordination Project and CEO of the Adelaide Western GP network, Health First. During his time with the divisions, he facilitated the rapid introduction of practice nurses into general practice via the Practice Health Atlas and the South Australian Health-funded Practice Nurse Recruitment and Training Program. So, as you can see, he brings extensive experience and knowledge in primary healthcare, the healthcare system reform and innovation and digital health, and here he is. Please welcome Peter Del Fante.